Welcome. My name is Dr. Novick. I'm an emeritus clinical professor of dermatology at the Mount Sinai School of Medicine, New York, and I have a private practice devoted to cosmetic dermatology on the Upper East Side. Today's video is devoted to the treatment of the agony of acne. Acne vulgaris, or common ordinary acne, is anything but a trivial condition. It is certainly the most widespread skin condition in the entire world. However, the impact of so-called ordinary acne can affect individuals emotionally, professionally, socially for their entire lives, something which is far from trivial. Let's begin by discussing the causes of acne. Acne is primarily a family trait, a genetic condition. Stress and other factors can certainly play a role, but it's bred into the genes, and there are multiple genes that interplay to cause acne, whether a person is going to have acne in the first place, and if they are, at what age it's going to begin, say at age 9 or at age 12, at what age it's going to be flared up tremendously, at what age it may be quiescent, at what age it'll come back, and at what age it'll eventually burn out. Now, it is a myth that acne is just teenage acne. Just ask anybody in his or her 20s, 30s, 40s, or 50s whether acne finished at the age at midnight of the 20th birthday. This is certainly a myth, and it's certainly insulting to people that who are in their 20s, adult people in their 20s, 30s, 40s, or even 50s, to call it teenage acne. So a couple of decades ago, we just simply reverted to calling it acne vulgaris, common acne, so as not to be insulting to all those people who actually suffer from it in their mature years. So when we say that the genetics is at the basis of acne, what is the genetic software dictating in actual fact? This is a normal pore. We have oil glands, a normal healthy pore. We have oil glands. We have a complete opening here where the oil gland secretions and dead cells flow right out of the pore, and that's the normal situation. But in the acne situation, what happens is the outlet of the pore becomes filled with sticky cells. It seems that the genetics dictates for not only too many cells being made at the outlet ramp of the pore, but they are also very sticky. So if you have lots of sticky cells in an area of where there's an egress to the surface, and now it becomes clogged, the next thing that happens is all the material accumulates in the pore, and you're going to get a whitehead, or if a little bit is exposed to oxidation of the air, you're going to get a blackhead. But if this situation continues, the material is still going to build up underneath, and it's going to explode into the red pimple. And then if that continues in that situation, it's going to become a pustule. And then, what's not shown in this diagram, it's going to become a nodule or a cyst. And eventually, as all kinds of wounds under the skin and on the skin, it'll eventually heal, except the healing will be in a scar. And the various kinds of scars are discussed in another video. So let's turn to the treatment of acne. It's really important that proper treatment be given early, very early on, because if acne is allowed to persist, especially nodules and cysts, then scarring almost inevitably will follow. And scarring is much more difficult to treat than the early stages of acne. But the early stages of acne do require intervention very early on. I mean, if an imminent scar from acne is treated between the end of week 4 to the end of week 12, we can actually prevent scarring. So it's important that acne not be allowed to persist for too long before the proper intervention is taken. While oral interventions, oral medications such as isotretinoin and oral antibiotics and oral hormones like spironolactone are so often given in the 5 or 10 minutes that most physicians have to treat patients with acne. I really have very strong objections to jumping to those avenues. Why? Because giving oral medications of any kind, whether it's playing around with isotretinoin, which may have effects that can show up 5, 10, or 20 years later, or the use of oral antibiotics such as minocycline or doxycycline, which may lead to resistant organisms so that when the medication is needed later in life, it may not be effective for other more serious conditions. Or hormones such as oral contraceptives when a person is not using them for contraceptive reasons but simply for acne treatments, or hormones such as spironolactone, which can affect periods and give breast tenderness and otherwise affect the body, because I have a very strong objection to making the entire body suffer for the sins of just the face. Proper intervention and topical treatments can actually get acne under control and prevent scarring. Rather than an office visit that consists basically of writing prescriptions for oral antibiotics and oral contraceptive medications, oral hormones, or isotretinoin, I actually spend the time doing a physical cleaning out of the comedones, the stuffed pores, the whiteheads and the blackheads. And if there are any cysts, these can be injected with intralesionally inside the nodules or the granulomas themselves, so that it would not affect the systemic system, but can shrink these bumps under the skin before they lead into scarring. Combining these in-office periodic treatments, I can also apply superficial peels, such as high concentration alpha hydroxy acid peels, or salicylic acid peels, or Yesner solution, or even low concentrations of trichloroacetic acid to help unstop the sticky glue at the exit ramp of those pores so that the contents can get out and it doesn't lead to the acne. Now, when you combine the in-office treatments with at-home proper use of topicals only, such as topical tretinoin or topical tazarotene or topical adapalene, along with perhaps azelaic acid or salicylic acid. It depends upon the individual situation which combination or which topical alone would get the job done. But if at-home and in-office treatments are combined, there's very little need for oral agents that make the body suffer for the sins of just the face. Certainly important to re-emphasize the fact that timely and early intervention with the topical at-home regimen and the in-office treatments must be done within the critical time frame to prevent permanent damage and permanent scarring. And this can be done. It's also important to emphasize that cleansing should be very gentle cleansing with a very bland kind of cleanser that is non-comedogenic, non-acne provoking, and non-greasy. Cosmetics that should be used are oil-free or water-based and best to be labeled non-comedogenic or non-acnegenic. And the cleansing should be done with only lukewarm water and the fingertips rather than with abrasive brushes, scrubs, or loofah sponges or buff puffs, as these can make the skin too dry and too irritated. And since most anti-acne topical medications can make the skin a bit on the dry side, to minimize and allow the use of the appropriate topical, the cleansing should be extremely gentle. It bears repeating. Early intervention to prevent scarring is absolutely critical. Do not spend a lot of time in playing around with home remedies or all kinds of organic products, as many of these products, the more organic they are, contrary to what people believe with the greening effect, the more possibility these heavy organic molecules can cause irritation of their own. And what we want to do is minimize irritation as much as possible and be as gentle with the skin as much as possible, because the topical anti-acne medications, just about all of them, can make people a tad on the dry side unless they use it properly, in the proper amounts, and with the proper timing after washing and cleansing. And so be cognizant of the fact that the earlier you seek proper intervention, the more likely you will not have to suffer the long-term consequences of acne vulgaris. For more information about this and other subjects, you can check out my website, youngerlookingwithoutsurgery.com, or Dr.Novick.com. That's DOCTORNOVICK.com. Thank you for your attention.